My name is Dr. Derek Nielsen. I work for LeBauer Physical Therapy, and I'm starting my own PT practice. It's called Kaizen Physical Therapy. The main reason I decided to work in the CashPT resident program is because I didn't want to go out and work for insurance-based practice. I had done that for my clinical rotations, and there was a point in time where I had worked with 4 patients at once, well, numerous times, and at that point I decided that's not the route that I wanted to go down. So I wanted to, instead of being like a cog in the wheel, I wanted to figure out how I can actually help patients one-on-one and get them to their goals faster without burning out myself. Working in the CashPT resident program, I think I learned communication, how to communicate with the patient, to get them to think about, or to get them to buy in, I guess. And I don't want to use buy in like a sales terminology, but in order for them to understand not just what they want, but what they need. So I would say communication, and then how to run a cash-based clinic, as well as how to treat better. I would say coming out of school, I was not fully confident, not even close to being fully confident with my treatment skills. So coming here also allowed me to hone in on what treatment strategies I thought were best, and what seems to work in a one-on-one, patient one-on-one type setting. First, I came out here without having a license, so for the first 4 weeks I followed Aaron around, and which actually honestly was a blessing in disguise, because it allowed me to see how he treated, and start really honing in on what I wanted to do. But outside of that, since the 4 weeks since I got licensed, I've been treating on my own, and to be honest, I don't think Aaron's even sat in on one treatment where I've been treating by myself. But occasionally I do still sit in with him, and we talk about patient scenarios, how we should progress them. It's how to communicate with the patient, how to get them to buy in, how to run a CashPT clinic, what systems you want to use, what systems you want to implement, and then treatment strategies. As far as mentoring goes, I could talk with Aaron almost as much as I want. He is a busy guy, so it doesn't happen all the time, but if you want to get in contact with him, you can. But treating in the one-on-one clinic has allowed me to have some available time, and when I have some downtime, it allows me to not just work on my business, but work on my treatment skills as well, and continue learning. And I've gone to quite a few different educational seminars along the way also. This program has helped me set up my own business for when I'm finished, because Aaron has given me a look into his systems, first of all. I'm going to be able to take anything that I want from here and use it, implement it into my own business. So as well as it just gives you a view into what a cash-based clinic looks like, how a successful one runs. It's not just per se that you have to take everything from it, but it gives you a view into a direction that you can take. If I was going to recommend it to somebody, I would say that if you want to go into starting your own business, and you don't want to go into a clinic where you're treating under insurance and you're treating 3-4 patients at one time, and you're so loaded that I don't have time after work to put in more time to start a business. This will allow you to start. This will allow you to have enough time to work on your business on the side, as well as learn how to treat patients in a cash-based setting, and learn the business, Aaron LeBauer's business at the same time. I would recommend the CashPT residency program to anybody who wants to start a CashPT clinic that doesn't know how to do it. And I think it's best for a new grad, because you're going to learn treatment skills as well as business skills. Aaron's program has been the single most boost of confidence. I mean, it's been, I'm ready. I've still got like 5 months here, but if I had to, I think I could start a business tomorrow. So it's me being ready, but now it's over the next 5 months, it's going to be me getting my business ready as well as continue honing in on some skills. The biggest difference the program has made for me is I feel ready to start my own clinic. I feel confident in treatment skills. I feel confident in communication. I mean, it's going to be a continual growth, but I feel confident enough to go out there and start treating on my own. I feel like all the skills are in place and the knowledge is there to be able to start doing my own practice. Like I said before, I don't feel like treatment-wise I was even close to being ready. And I think that Aaron does underestimate the fact that you know, treatment out of school, I think majority of PTs couldn't do a cash-based setting. Or maybe that's just me, I'm not sure, but I do think that majority can. And being so close in it, I don't think Aaron sees how much he actually, I guess, his treatment strategies, and he doesn't necessarily think that they're any better than anybody else's. And he even said to me one time, he didn't think he was that good.